Welcome. Punishment contingencies are among the most misunderstood yet high-yield concepts on the BCBA exam, and this session will give you the clarity you need. We're breaking down positive versus negative punishment, not by whether something feels good or bad, but by whether a stimulus is added or removed to decrease a behavior. You'll walk through real-world examples across settings, compare the two directly, and distinguish unconditioned punishers from conditioned ones. Perhaps most critically, we'll clarify the difference between punishment and extinction, a distinction that trips up many candidates. Because these procedures fall squarely under Domain G, behavior change procedures, mastering them is essential for both the exam and ethical practice. Let's build a precise, functional understanding of punishment that you can apply to any scenario. Let's clarify the distinction between positive and negative punishment, because the BCBA exam will test whether you can identify each based on the operation, not the label. Positive punishment involves adding an aversive stimulus immediately after a behavior to decrease its future frequency. For example, a sharp reprimand after a child yells. Negative punishment involves removing a desirable stimulus immediately after a behavior to decrease its future frequency, such as taking away screen time after a rule violation. Both contingencies share a critical feature. They are defined by their effect, reducing the future likelihood of the target behavior. If behavior does not decrease, punishment has not occurred. The consequence must be delivered contingent on the behavior, meaning it follows the response reliably. Remember, punishment is an operant contingency. The behavior is controlled by its consequence, not just the antecedent. On the exam, you may be asked to distinguish punishment from reinforcement. Both can be positive, adding a stimulus, or negative, removing a stimulus. But punishment decreases behavior while reinforcement increases it. Focus on the effect on future behavior. This slide illustrates how positive punishment operates across clinical, educational, and everyday settings. A key distinction for the BCBA exam, because you must identify the contingency, not just the procedure. In each example, a stimulus is added following a behavior, which decreases that behavior's future frequency. In clinical settings, a verbal reprimand contingent on self-injury or physically guiding a client back after elopement adds an aversive stimulus. Note that timeout is listed here as positive punishment because the therapist briefly adds a procedure that removes access to reinforcement. However, on the exam, timeout is typically negative punishment unless it involves contingent observation. In education, extra homework or laps during recess add effort-based consequences. Everyday examples like yelling or a speeding ticket show how natural communities use added stimuli to suppress behavior. For the exam, always check, is something added? If yes, and the behavior decreases, it is positive punishment, regardless of how unpleasant the added stimulus seems. Negative punishment removes a reinforcer after a behavior occurs, reducing the behavior's future frequency, and the BCBA exam often tests your ability to distinguish its variations. On this slide, timeout from reinforcement involves removing access to all sources of reinforcement for a brief period contingent on problem behavior. This is not a timeout from the setting, but from all positive reinforcement. Response cost, by contrast, removes a specific amount of a reinforcer, such as tokens or points, which is a more precise procedure often used in token economies. Loss of privilege, like taking away screen time following noncompliance, is a common real-world application that still fits the response cost framework. Contingent observation removes a child from an activity and requires them to watch others engaging appropriately before returning, blending punishment with a modeling component. For the exam, remember that all these procedures require the reinforcer removal to be contingent, immediate, and functionally related to the behavior's decrease. And you must identify which variation is described in scenario-based questions. This slide lays out the critical distinction between positive and negative punishment, both of which serve the same function, decreasing future behavior, but through opposite operations. Positive punishment adds an aversive stimulus, like reprimands or overcorrection, while negative punishment removes a desirable stimulus, such as through timeout or response cost. For the BCBA exam, you must recognize that the key difference lies in the operation, not the effect. Both contingencies carry potential side effects. Positive punishment may elicit aggression or escape behaviors and can negatively reinforce the punisher, whereas negative punishment may produce emotional responding or an extinction burst if combined with extinction. Ethically, negative punishment is often preferred as it is less restrictive, but you must verify that the removed stimulus is truly reinforcing. Remember, the exam will test your ability to identify which contingency is in place based on whether a stimulus is added or removed, not on the behavior change itself. Always consider the least restrictive alternative when designing interventions. On this slide, we distinguish between unconditioned and conditioned punishers, a key distinction for the BCBA exam. Unconditioned punishers, like pain or extreme heat, are inherently punishing due to biological relevance. No learning history is needed. Conditioned punishers, such as a reprimand, become punishing through pairing with existing punishers. A generalized punisher, like the word no, is a conditioned punisher paired with many different punishers, making it effective across diverse situations. Punishment can be automatic, like the pain from a hot stove, or socially mediated, like a parent scolding. For the exam, remember that punisher effectiveness hinges on immediacy, consistency, intensity, and the individual's history. Always individualize. Critically, a punisher is defined by its effect. It decreases behavior, while a reinforcer increases it. The same stimulus can function as either depending on context, so you must analyze function, not form. Expect scenario-based questions asking you to identify whether a stimulus is unconditioned or conditioned, or to predict its effect based on the individual's history. On this slide, we're distinguishing punishment from extinction, a high-yield exam distinction. Both procedures decrease behavior, but they operate differently. Punishment involves adding or removing a stimulus contingent on the behavior, while extinction withholds the maintaining reinforcer entirely. Punishment typically produces a quicker decrease, whereas extinction leads to a gradual reduction, often preceded by an extinction burst, a temporary increase in behavior that is not typical of punishment, though emotional responding may occur. Spontaneous recovery is less common with punishment. Behavior may return only if the contingency is removed, whereas extinction often sees sudden reemergence of the behavior. The contingency also differs. Punishment delivers a consequence contingent on the behavior, while extinction simply stops delivering reinforcement. Ethically, punishment requires careful monitoring due to potential side effects like aggression, while extinction is often preferred but must ensure safety during the burst. On the exam, you'll need to identify which procedure is in effect based on these operational and behavioral differences. When implementing punishment contingencies, the BCBA exam expects you to follow a systematic, ethical process. First, you must identify the target behavior in observable, measurable terms. This ensures you are decreasing a socially significant behavior, not just a nuisance. Next, select the punishment type, positive or negative, based on the behavior's function, client preferences, and the least restrictive alternative. The exam will test your ability to justify this choice. Then, determine contingency parameters. Specify the punishing stimulus, its intensity, duration, and schedule, and remember that immediacy and consistency are critical for effectiveness. A delayed punisher weakens the contingency. Finally, monitor and adjust by collecting data on the target behavior and any side effects like aggression or escape. If no decrease occurs, you must adjust the punisher or consider alternative procedures. The exam emphasizes that punishment alone is rarely sufficient and should be paired with reinforcement for alternative behaviors. This step-by-step framework ensures ethical, data-driven decision-making. For punishment to be effective on the BCBA exam, you must evaluate 4 key factors. Immediacy is critical. The punishing consequence must occur right after the behavior to establish clear temporal contiguity, so the learner connects the action to the outcome. Consistency means applying the punisher every single time the behavior occurs. Intermittent application weakens the contingency and actually strengthens the behavior through a variable schedule. Intensity must be sufficient to suppress the behavior. Too weak and it's ineffective, too strong and it risks side effects like aggression or escape behaviors. Finally, and most importantly for exam questions, reinforcement for an alternative behavior is essential for long-term success. Punishment alone teaches what not to do, but without a replacement behavior, the learner has no appropriate option, often leading to relapse. Expect scenario-based questions where you must identify which factor is missing or compromised. When considering punishment contingencies, The BCBA exam emphasizes that ethical implementation is not optional. It is a core competency. Punishment must be the least restrictive alternative, meaning you only turn to it after reinforcement-based procedures have failed or when a behavior poses immediate danger. You must secure informed consent, fully explaining risks, benefits, and alternatives to clients and stakeholders. Data-based decision-making is non-negotiable. Ongoing collection tracks effectiveness and side effects. If no decrease occurs, modify or discontinue the procedure. Client dignity demands that punishment never involves humiliation or unnecessary discomfort. Close supervision by a BCBA and regular review ensure correct, ethical implementation. Crucially, always pair punishment with reinforcement for a functionally equivalent replacement behavior. This promotes durable, ethical behavior change. On the exam, expect scenario questions testing your ability to prioritize reinforcement first, monitor data for efficacy, and maintain dignity throughout. Remember, punishment is a last resort, not a first response. Now, let's look at how positive and negative punishment play out in real-world scenarios. This is exactly the kind of distinction you'll need on the BCBA exam. In positive punishment, an aversive stimulus is added after a behavior to reduce its future occurrence. In negative punishment, a desirable stimulus is removed. Notice the pattern. When a child hits a sibling, a verbal reprimand adds an aversive, while losing tablet time removes something desirable. For a student talking out of turn, extra homework adds an aversive, but losing recess removes a reinforcer. Property destruction might lead to overcorrection, adding effort, or losing a token, which removes access to backup reinforcers. Even with a dog jumping, a firm off and push adds an aversive, while ignoring removes attention. For exam questions, always ask, is something being added or taken away? The consequences effect, decreasing behavior, is the same, but the contingency differs. Master this distinction, and you'll handle punishment questions with confidence. Let's bring together the key takeaways for punishment contingencies, because the BCBA exam will test your ability to distinguish and apply these principles precisely. First, remember that punishment is defined solely by its effect, a decrease in future behavior. Whether you add an aversive stimulus in positive punishment or remove a desirable stimulus in negative punishment. Positive punishment includes procedures like reprimands or overcorrection, while negative punishment covers timeout and response cost. You'll also need to know that punishers can be unconditioned, like pain, or conditioned, like a stern no, which gains its punishing power through pairing. Critically, the exam emphasizes ethical safeguards. Punishment should only follow failed reinforcement-based interventions, requires informed consent and ongoing data monitoring, and must always prioritize client dignity. Finally, for lasting behavior change, you must pair punishment with reinforcement for a functionally equivalent alternative behavior. This ensures you're not just suppressing behavior, but teaching a replacement, which is a core competency you'll be expected to demonstrate on exam questions about ethical and effective behavior reduction. As we close, remember that punishment contingencies, whether positive like a reprimand or negative like a loss of tokens, are defined by the effect of decreasing behavior, not the procedure's pleasantness. You've seen how unconditioned punishers like pain differ from conditioned punishers like a stern look, and how extinction differs by withholding the maintaining reinforcer entirely. The side effects, aggression, escape, and overgeneralization, remind us why punishment must be a last resort, ethically justified only after reinforcement-based strategies fail. For the exam, focus on identifying the contingency. Is a stimulus added, positive, or removed, negative to reduce behavior? Practice with scenarios where the consequence is clearly contingent and immediate. Your real challenge is to pair this knowledge with compassion. Punishment can work, but it carries risks. As you study, commit to thinking like a behavior analyst. Prioritize reinforcement, document everything, and always ask if the procedure is necessary and humane. You've got the tools. Now trust your analysis and keep pushing forward.